Hi mga Beshi or mga Joffy. This is Dr. Jonathan Flordelis. You can call me Dr. Joff. I'm here at the Cebu Orthopedic Institute. And today, magstoryeta, we want to talk about objections because kung na patient that comes to the clinic, storya ng mga pasyente nako, they ask me, Dr. Joff, kaya pa ba? Tigulang nako. Because they have an idea, a thinking na because they have a certain age, dili na sila makalakaw after surgery. They say, tungod kita ko sa akong silingan, Dr. Joff, di na sila kalakaw after sa operasyon. So, as an orthopedic surgeon that specializes in hip and knee surgery, I can say na dili ni siya pariha o operasyon sa kasing-kasing. When you have a problem sa heart, the heart surgeon will give you maybe, 50% chance something might go wrong, something might go right. But in most of the knee and hip surgeries, I will tell you 98% of patients do well. 98 out of 100 patients are doing well and walking again. And with regards to age, para nako, it is not the age. Pilay edad nimo, you may be 80 years old. I have patients who are 80 years old, very strong, living alone. Sila ra ang naa sa balay, walay kauban, walay katabang. Sila ra magluto, maglaba, tanan. So it is not the age. Physically, you have a different age. Physiologically, sa imong lawas, posible na imong edad 80 anyos, pero ang imong lawas, murag lawas o maybe 50 anyos. Pwede sa na baliktad. There are patients who are very physiologically old, meaning they are only maybe 50 years old, but because of so many medical problems, they are looking like 80 or even 90 years old. Naka-wheelchair na and daghan kay mga medical problems. But of course, I'll show you my patients who are actually already walking after their procedure. Age is not an issue for me. This patient is actually 2 years after her knee replacement. She's walking nicely. I saw her just after the pandemic and she's walking nicely. This patient is still in the hospital 3 days after she's already walking. And we have another patient who's 3 months after her knee replacement surgery, also doing therapy in her province, and she's giving us a nice little dance. That's cute. And another patient just a day after her knee replacement surgery, very happy. And a knee replacement surgery is a surgery for severe arthritis when everything else has failed, the medicines, the supplements, the injections. This is something that we can offer. The procedure is done in about 1 to 2 hours, and you can stay in the hospital for a while. Once you're able to walk, you're off in the hospital. A knee scope is a camera procedure that can be an outpatient procedure. We do this for cleaning up meniscus injuries or even tears and cartilage defects. We try to make the knee run smoothly as possible. This is what you see here. The camera is smaller than a ball pen. Ang samad ani gamay sa kayo. Very tiny. And that is how patients are able to walk because the incision is very small. This lady is a few days after her knee scope, walking very nicely. And this other lady is also showing us what she can do. She's doing her walk. She's also showing us that she can exercise nicely. That is something that you can do after a knee scope. So I hope this inspires you. This could be your own relative tripping and falling in your home and fracture their hips. So good morning, this is Dr. Joff again. The truth is, a lot of patients with hip fractures need urgent surgery. If you don't get the surgery, they don't get to walk or move again properly. And they have groin pain, sakit sa bugan, sakit sa singit. And these patients need urgent surgery. We do this through a procedure called a hip replacement. Now, patients are walking as early as 24 to 48 hours after surgery. They're able to go home with a walker and transition from walker to a cane within the next week. And within the month, he was able to transition to walk without any assistive device. So today I'm going to visit my patient who was operated yesterday for hip. Come, let's go see her. Ay mong tail, malihok ka ni mo, no?
Malihok na ko.
Mausa na ako, naman nakatilog ka ganina. If you know someone with a hip fracture, please let them know hilot albulario is not the treatment of choice. The fractures will get worse the more they move or the more they are manipulated. These patients actually need surgery urgently.
Very good.
Now this is one of my favorite procedures. We now can do hip replacement surgery without cutting any muscle. And even if that sounds impossible, it's actually an amazing thing. It's called the direct anterior hip replacement. And when we do this, I can say that in other countries, they are doing hip replacements as outpatient procedure for special patients. But here, I'd like to keep the patients at least overnight. And this particular lady, I discharged the next day. So they can be discharged walking the next day after the procedure. And again, it's not a matter of how old the patient is. If the patient is medically cleared by the cardiologist or for any medical problem that they have, it's very, very possible that they can walk again. Especially if the patient is physiologically strong, meaning kusgan ug lawas, and it's just that they happen to have a fracture. We can do a hip replacement for osteoarthritis, for hip fractures, and for even AVN or avascular necrosis, bone that has been dying in the hip. So I hope this is something that is important for everyone here who is listening. I hope that this is valuable because it is not true that you cannot walk after surgery. We try to do our best so that you can walk again, and we try to make sure that you are 100% safe. And that is why we talk with your present doctors and get clearance from them. I hope to see you soon. May our paths cross in the future. Bye-bye.